Hemorrhoids, 10 piles symptoms that could be a medical emergency. Are you dealing with the discomfort of hemorrhoids, also known as piles? Did you know that while many piles symptoms can be managed at home, some can indicate a serious medical issue requiring immediate attention? It's crucial to distinguish between typical hemorrhoid symptoms and those that warrant a trip to the emergency room, as delaying treatment for severe issues can lead to significant complications and impact your overall health. Before we explore 10 piles symptoms that could signal a medical emergency related to hemorrhoids, please remember this video offers general information and should not replace advice from a medical professional. If you experience any of these hemorrhoid symptoms, consult a doctor immediately for proper diagnosis and treatment. The science-backed resources supporting the information presented in this video can be found in the description below. Welcome to our daily health. Many people experience hemorrhoids or piles and often find relief with home care. However, it's crucial to recognize when piles symptoms are beyond self-treatment and could indicate a medical emergency. Ignoring these warning signs can lead to serious complications and impact your long-term well-being. This video will highlight 10 hemorrhoid symptoms that warrant immediate medical attention to ensure your health and well-being. Recognizing these symptoms early can make a significant difference in your outcome and prevent potentially life-threatening situations. Here are 10 piles symptoms, hemorrhoids, that could be a medical emergency. Number 1. Severe rectal bleeding, a potential sign of serious hemorrhoid complications or other conditions. While some bleeding is common with hemorrhoids or piles, a large amount of rectal bleeding is not normal and should be considered an early warning sign of a medical emergency. This is characterized by blood that soaks through multiple pads, significantly stains the toilet bowl, or includes clots, indicating a substantial loss of blood. While mild bleeding often originates from damaged hemorrhoids or anal fissures caused by straining, heavy bleeding could indicate a more severe hemorrhoid issue, such as a ruptured blood vessel or even a different underlying condition that requires immediate medical evaluation, such as inflammatory bowel disease, IBD, diverticulitis, or even colorectal cancer, especially if accompanied by unexplained weight loss or persistent abdominal pain. Do not hesitate to seek emergency medical attention if you experience significant rectal bleeding. Number 2. Dizziness or lightheadedness accompanied by rectal bleeding, suggesting significant blood loss and potential shock. Experiencing dizziness or lightheadedness, along with any rectal bleeding from hemorrhoids or piles, is a serious symptom that could indicate significant blood loss. This combination suggests that the bleeding is substantial enough to lower your blood pressure, potentially leading to a dangerous condition called hypovolemic shock, where your organs aren't getting enough oxygen-rich blood. Symptoms of shock include rapid shallow breathing, dizziness or lightheadedness after standing up, blurred vision, fainting, confusion, nausea, and cold, clammy, pale skin. This situation can be life-threatening and requires immediate medical attention to stabilize your condition and address the source of the bleeding. Call for emergency medical services without delay. Don't attempt to self-treat in this scenario. Seek emergency medical help immediately. Number 3. Severe and sudden rectal pain, potentially indicating a thrombosed external hemorrhoid or other acute anal issues. Sudden and excruciating pain in the anal area, often accompanied by a hard, tender lump near the anus, could be a sign of a thrombosed external hemorrhoid. This occurs when a blood clot forms within an external hemorrhoid, causing intense pressure and inflammation. While not always life-threatening, this condition can be intensely painful and may require prompt medical intervention, such as draining the thrombus clot with a small incision under local anesthesia, to provide significant relief and prevent potential complications. However, sudden severe anal pain could also indicate other acute anal issues like an anal fissure, a tear in the lining of the anus, or an anal abscess, a collection of pus, which also require medical attention to prevent further complications and manage the pain effectively. Don't delay seeking medical evaluation for sudden severe anal pain that doesn't improve with basic home care. Found this video valuable? Like and subscribe for more health tips. Drop your comments or questions below. We're eager to hear from you. Please share this video to help others. Number 4. Prolapsed hemorrhoid that cannot be manually reduced, suggesting strangulation risk and potential tissue damage. A prolapsed internal hemorrhoid that has descended outside the anus and cannot be gently pushed back in is a serious symptom, If left untreated, the blood supply to the hemorrhoid can become cut off strangulation, leading to severe pain, tissue death, necrosis, and potentially requiring surgical intervention as a medical emergency. The trapped hemorrhoid can swell significantly, further restricting blood flow and causing intense pain that is often unbearable. Prompt medical attention, often involving manual reduction by a healthcare professional or even surgical intervention, can prevent serious complications like infection and tissue loss. Number 5. Fever accompanied by butt pain and swelling, possible sign of a spreading infection requiring immediate treatment. Developing a fever, a body temperature of 100.4 degrees Fahrenheit or 38 degrees Celsius or higher, along with significant anal pain, swelling, redness, and potentially pus drainage in the area of your hemorrhoids or piles, could indicate a localized infection. An untreated anal infection can spread to surrounding tissues and even enter the bloodstream, leading to a serious medical emergency called sepsis, which is a life-threatening response to infection. Prompt antibiotic treatment, often administered intravenously in severe cases, and potentially surgical drainage of any abscesses are crucial to control the infection and prevent life-threatening complications. Do not ignore fever combined with anal symptoms. Seek immediate medical care. Number 6. Different pooping patterns accompanied by rectal bleeding could indicate a more serious underlying condition beyond hemorrhoids. New or significant changes in your bowel habits, such as persistent diarrhea, constipation, a change in stool caliber, narrower stools, or a feeling of incomplete evacuation, especially when accompanied by rectal bleeding, that you attribute to hemorrhoids or piles, could actually be a sign of a more serious underlying condition. This includes inflammatory bowel disease, IBD, diverticular disease, or even colorectal cancer, particularly in individuals over 50 or with a family history of these conditions. While hemorrhoids can cause bleeding, a change in bowel habits warrants immediate medical evaluation, including a colonoscopy, to rule out these medical emergencies. Don't assume bleeding is only from hemorrhoids if your bowel habits have changed. Get it checked by a doctor. Number 7. Severe itching that doesn't respond to home care may indicate a different issue or a secondary infection. While itching, pruritus ani, is a common symptom of hemorrhoids or piles, severe and persistent itching that doesn't improve with typical home remedies like witch hazel or over-the-counter anti-itch creams could indicate a different dermatological condition, such as eczema or psoriasis, a fungal or bacterial infection of the anal skin, or even a parasitic infection like pinworms. A medical professional can properly diagnose the cause of the severe itching through a physical examination and potentially skin scrapings or other tests, and recommend appropriate treatment, which may differ significantly from standard hemorrhoid care. Don't dismiss persistent severe itching as just hemorrhoids. Seek medical advice for proper diagnosis and management. Number 8. Large external lump that is increasingly painful and swollen, potential abscess formation requiring drainage. A large external lump associated with your hemorrhoids or piles that becomes increasingly painful, red, warm to the touch, and significantly swollen could be a sign of an abscess formation. An anal abscess is a collection of pus that requires medical drainage, usually through a surgical incision, to relieve pressure, remove the infection, and prevent it from spreading to deeper tissues, potentially causing a more serious medical emergency. Delaying treatment can lead to a more complex and difficult-to-treat infection, potentially requiring more extensive surgical intervention. Number 9. New onset inability to control bowel movements, fecal incontinence, with hemorrhoid symptoms, may indicate nerve damage or other anorectal problems. New onset fecal incontinence, the involuntary loss of stool, occurring alongside hemorrhoid symptoms, could indicate a more serious underlying issue, potentially involving nerve damage to the anal sphincter muscles due to childbirth, surgery, or other medical conditions, or a different anorectal problem, such as a rectal prolapse, where the rectum protrudes through the anus. This requires prompt medical evaluation, often involving specialized testing like anorectal manometry, to determine the cause and appropriate management, which may include physical therapy, medication, or surgery. Don't attribute fecal incontinence solely to hemorrhoids without a thorough medical assessment. Number 10. Any sudden and dramatic worsening of hemorrhoid symptoms signaling a potential complication requiring immediate attention. Any sudden and dramatic worsening of your existing hemorrhoid symptoms, such as a significant and rapid increase in pain intensity, a sudden increase in swelling or the development of a new firm lump, or a sudden onset of heavy bleeding, should be considered a potential medical emergency. This could indicate a serious complication such as acute thrombosis with significant inflammation, strangulation of a prolapsed hemorrhoid, or a ruptured blood vessel requiring immediate medical attention for relief and to prevent further issues and potential long-term damage. Do not wait and see if your hemorrhoid symptoms suddenly and severely worsen. Seek immediate medical care.